Hello, everyone. My name is Alisha Bent. I'm an assistant professor in GI medical oncology at MD Anderson Cancer Center, and I want to discuss a really exciting lifestyle intervention study that we have here at MD Anderson called the DAILY study. So just briefly, adjuvant therapy is essentially therapy that is given after you receive surgery for colon or rectal cancer. And there are lots of challenges to adjuvant therapy in colorectal cancer. We're not quite sure, what we can check, what tests we can check, like blood tests or even tests on tumor tissue that will allow us to predict who will really respond to chemotherapy after surgery. We know that there are some potential toxicities of chemotherapy. And also, we know that even when we give chemotherapy after surgery, not all patients are actually cured. And so we're really interested in trying to identify some alternatives outside of chemotherapy to try to treat patients, although this has been quite challenging over the years. So here at Anderson, we are certainly interested in using something that we call circulating tumor DNA in order to try to identify, cancer that we can't see on imaging, so microscopic cancer, and to see if there are things that we can develop in order to get rid of the cancer cells that we can't see and overall improve outcomes for our patients. Just briefly, circulating tumor DNA, it's essentially kind of fragments of DNA that are derived from the tumor. These are actually released by the cancer cells into the bloodstream by various mechanisms. But essentially, this is disease that we can't see on imaging. Right? And so this concept of ctDNA has been rapidly kind of accepted as a reliable tool in oncology. And kind of focusing on the efforts of ctDNA or circulating tumor DNA in colorectal cancer in particular, we know that with patients that have detectable levels of ctDNA after they have completed adjuvant chemotherapy, there was a study that showed that there was a pretty high sensitivity or even positive predictive value to say that those patients will ultimately recur on imaging. The amount of time between the positive blood ctDNA test and developing cancer on imaging that we can see on average was about 9 months. And so how can we really leverage the ability to detect ctDNA in the blood when there is no evidence of cancer on imaging that we can see? Well, we're really focused on trying to utilize the ctDNA as a marker for studies so that we can try to stratify patients to determine, who should get, maybe an escalated chemotherapy regimen versus a de-escalated chemotherapy regimen. We'd also love to look into some novel therapeutic options to try to eradicate the disease in the blood. And I think long term, we can kind of learn more about just the tumor and how tumors can change over time as well. And so very, very briefly here, this slide is essentially saying that, there have been a lot of observational studies in stage 1 through 3 colorectal cancer that have shown that lifestyle, modifications may demonstrate kind of a reduced recurrence risk. Specifically, the epidemiology data is consistent that, diet, vitamin D supplementation, aspirin supplementation, and even exercise are associated with reduced risk of recurrence. There's a lot of interest kind of over in the UK as well as in Canada with looking into very large clinical trials in stage 2 and 3 patients to try to see if these, lifestyle interventions are indeed successful. And as one can imagine, if they work, then we are essentially assuming that, patients are eliminating that microscopic disease in the blood that we can't see. And so we really feel that the circulating tumor DNA testing can allow for a more efficient approach to try to test these lifestyle strategies. Again, this is the data from observational studies, stage 1 through 3 colorectal cancer, that is proven to reduce the cancer risk. Aspirin supplementation, physical activity, really avoiding Western dietary patterns is where you get the most bang for your buck. Higher vitamin D levels, as well as avoiding what we consider to be class 2, 3 obesity. The following that has not been shown to be associated with recurrence is multivitamin supplementation, very drastic weight changes, and that's either gain or loss, non-smoking status, as well as a BMI below 35. And these slides are essentially kind of just showing, how when they looking at patients who were stage 3 colorectal cancer who consistently reported use of aspirin kind of following, surgery. And I think the consistent use was actually defined as patients who had aspirin used midway through the chemo and then, 6 months after completing chemo. And, you can see that those patients did have kind of lower rates of recurrence compared to patients who did not report consistent aspirin use. There was another study that was done, the Nurses' Health Study. They looked at kind of overall colorectal cancer specific and as well as just overall survival. And this is with kind of post-diagnosis aspirin use. And you can see that there was improvement in both colorectal specific as well as overall survival for these patients. Looking at some of the prospective studies in post-diagnosis physical activity, you can see that, again, based on these few observational studies that had quite a few patients, actually, the CalVG 89803 had about over 800 patients, again, stage 3 cancer patients. And you can see that the regular physical activity did appear to reduce the risk of cancer recurrence. And this was particularly in patients who had what we call kind of 18 to 27 metabolic equivalent task hours per week. And then to the right of the screen, the Nurses' Health Study, again, showed with greater than 18 MET hours per week, patients did seem to have improved colorectal cancer specific survival. Dietary patterns that have been kind of shown thus far is that, really avoiding Western dietary patterns, so your fried and fatty foods, very high saturated fat foods. Patients who avoided those patterns did seem to have improved, outcomes. Although patients who had a very strict, prudent diet did not necessarily demonstrate that same benefit. Looking at vitamin D levels, there have been some kind of preclinical data that has suggested that there might be some anti-cancer properties associated with vitamin D. Again, still being studied, but some exciting data nonetheless. And we can clearly see from this observational study that, patients who had higher levels of vitamin D did seem to have a decrease in the risk of colorectal cancer as well. So kind of focusing on the daily study. So this is essentially a study for colorectal cancer patients who have completed surgery. They've completed their chemotherapy after surgery. There's no evidence of cancer that we can see on their imaging. But when we do the blood test looking for the circulating tumor DNA, the test is positive. Okay? For those patients, we are actually subjecting them to lifestyle interventions for a total of 3 months. Okay? Almost like our little boot camp, if you will. And what we're doing is that we are going to measure to see if after, compliance with lifestyle interventions for 3 months, patients are able to clear the circulating tumor DNA that we found in the blood. If patients don't completely clear the ctDNA, we'll look to see if the amount of the ctDNA that we're detecting has decreased. And so patients who are eligible for this study, not only are the stage 2, high risk stage 2, as well as stage 3 patients eligible, but also if patients have had metastatic disease, but they were able to get all of the disease that we can see on imaging resected. And so there's no disease, that we can see on imaging at this point, and those patients would also be eligible potentially for this study. Outside of that, things that would exclude patients, unfortunately, because if there is another cancer that they're being treated for, if there's significant kidney dysfunction, or just kind of elevated levels of calcium or kidney stones, and that's simply because of the vitamin D that we're using that could make those worse. So what are the lifestyle interventions in the daily study? So we'll be giving patients a weight-based aspirin supplementation. And so if you're over 70 kilos, you'll be getting aspirin, a full dose aspirin of 325 milligrams per day. If you're less than 70 kilos, you'll be getting a baby aspirin at 81 milligrams daily. The vitamin D dosing will be cholecalciferol. And you can see there that patients will get, 8,000 international units daily for the first 2 weeks and followed by 4,000 international units daily thereafter. We will be focusing on a plant-based diet and really just avoiding those Western dietary patterns for the reasons that I had mentioned kind of previously. The exercise goal will be to kind of increase recreational physical activity from your baseline by at least 10 metabolic equivalent task hours per week. Just of note, that is essentially equivalent to about 150 minutes of moderate activity weekly. Now, we will be providing formal dietary counseling sessions with a licensed nutritionist at baseline. She will be able to walk patients through what not to eat, what to eat more of. We'll have a food frequency survey that is very user-friendly to be done at, prior to starting as well as monthly. And we're actually going to be providing Fitbits to all of the patients in order to keep up with some of the activity tracking. Another exciting part of this study is that in order for us to try to really encourage compliance with the physical activity goals, we're going to be doing 2 telephone coaching sessions per month for the duration of the 3 months, and this will be done by a clinical exercise physiologist. Now, she will not necessarily provide a very strict physical activity plan that you have to follow, but she'll give you a list of activities that based on your, capabilities, you could perform and kind of pick and choose from. And so, overall, we really want to better understand some of these kind of complementary approaches to colorectal cancer treatment. We feel that this would really be of benefit to our patients. And so, this is something that certainly, patients who are not necessarily local to Houston can partake in. If, patients are found to have positive levels of circulating tumor DNA, nothing on imaging, but they're not quite ready to kind of jump into another clinical trial that will require kind of more cytotoxic chemo, then this could potentially be a great option for those patients as well. And, we really hope that, during this study, we can use the data to try to really potentially do even bigger kind of prospective studies in the future. So this study is activated. We are currently enrolling. We have several slots left. And so feel free to reach out to me if there are any questions. Be happy to assist. Thank you.